Cancer, a disease that has haunted humanity for thousands of years, has a history dating back to ancient Egypt. In this exploration, we delve into the origins of cancer diagnosis and treatment, the ancient techniques used to deal with tumors, and the evolution of understanding about this disease through the centuries. The earliest written observation of cancer in humans comes from Egypt. The Edwin Smith Papyrus, dating back to the Pyramid Age, around 3000 to 2500 BC, provides the earliest description of a human tumor, presumed to be written by Imhotep, an architect, physician, and statesman. This oldest known surgical treatise on trauma contains a collection of 48 medical cases, including several case studies on breast tumors. The ancient Egyptian physicians used ocular and tactile approaches to methodically examine and diagnose tumors. They described various visual and tactile characteristics of tumors, astonishingly similar to the descriptive data that modern physicians might use today. The Edwin Smith Papyrus offers valuable insights into the treatment methods used by these ancient healers, including the first reference to cauterization as a surgical treatment for tumors. Some treatment methods in the papyrus may seem odd by today's standards, but they reveal an early understanding of hemostasis, emollients, and the need to protect the tumor area from the environment for successful treatment delivery. Interestingly, there is a case of a bulging tumor with swelling spread over the breast and cool to the touch, for which the physician did not prescribe any treatment, possibly because it was untreatable at the time. Despite their advanced numerical skills, the ancient Egyptians' medical texts were largely non-numeric. Perhaps numeracy was not considered an essential part of ancient Egyptian medicine or clinical texts. Yet, these ancient physicians recognized the significance of fever as a diagnostic sign and distinguished between hot and cold tumors, resorting to palpable approaches for sensing temperature. The thermometer, as we know it today, was only invented much later in 1709 AD by Daniel Fahrenheit. The word cancer was first used by Hippocrates, the father of modern medicine. However, evidence of cancer has been found in fossilized remains of dinosaurs, fish, and human skulls. Ancient Egyptians blamed cancer on the gods, and it wasn't until the 16th century when scientists started to view cancer as a contagious disease. With the discovery of blood circulation in the 17th century and the introduction of surgery for cancer treatment in the 18th century, theories about cancer began to change. Researchers started to believe that cancer grew from the lymph, a bodily fluid thrown out by the blood. During the 19th century, pathologists used microscopes to study cells in normal and cancer-affected human tissues. This led to the popularization of the theory that cancer grew from cell division, marking a significant advancement in our understanding of the disease. Today, we have a deeper understanding of cancer, including its genetic components, risk factors, and cellular processes. This knowledge has paved the way for innovative treatments like chemotherapy, radiation therapy, immunotherapy, and targeted therapies. With advances in early detection and improved treatments, cancer survival rates have increased significantly in recent years. However, the battle against cancer is far from over, and ongoing research aims to develop even more effective treatments, prevention strategies, and ultimately, a cure. As our understanding of cancer continues to evolve, researchers are exploring new frontiers in cancer treatment and prevention. Breakthroughs in gene editing, personalized medicine, and immunotherapy are just a few of the exciting developments that hold promise for a future with more effective and less invasive cancer treatments. Collaboration between researchers, clinicians, and patient advocates is essential to accelerate progress in the fight against cancer. Through the sharing of knowledge and resources, we can continue to push the boundaries of what is possible in cancer research and treatment. The history of cancer, from ancient Egypt to the present day, is a story of humanity's relentless pursuit to understand and conquer this disease. Our understanding of cancer has come a long way since the time of the Edwin Smith Papyrus. As we continue to learn more about cancer and develop innovative treatments, we carry on the legacy of those who have come before us fighting for a future free from the fear of cancer. Looking back at how far we have come in our understanding of cancer and our ability to treat it, we're reminded of the importance of continued research and investment in the field of oncology. Breakthroughs in technology, genomics, and immunology have already revolutionized cancer treatment and will continue to do so in the years to come. Each new discovery made is a stepping stone towards better outcomes for cancer patients and ultimately the possibility of eradicating the disease entirely. While we continue to seek answers and develop new therapies, it is important to remember that prevention and early detection play crucial roles in the fight against cancer. Public health campaigns, educational efforts, and access to screening and diagnostic tools can help reduce the incidence and mortality rates of various types of cancer. Moreover, it is essential to support those currently battling cancer by providing them with compassionate care, access to cutting-edge treatments, and emotional support. Cancer survivors and their families are living testimonies to the progress we have made and serve as an inspiration for researchers, clinicians, and advocates alike. In conclusion, the history of cancer demonstrates humanity's unyielding determination to overcome one of the most challenging diseases we face. As we continue to build upon the knowledge and advances of our predecessors, we stand united in the quest for a cancer-free world. By combining the efforts of scientists, healthcare professionals, and cancer survivors, we can look forward to a future where cancer is no longer a threat to the lives of millions around the world.